Good morning, sir.
Yeah, good morning, Mrs. Leonard.
Yes, sir. Yes, sir.
Yeah, are you seeing my slide?
No, sir. The what is showing is that Dr. Akma has paused screen sharing.
I'm not
You've paused
supposed
the
to pause.
screen
I don't
sharing.
know what I pressed.
Good morning, sir.
Good morning.
Yes.
Okay.
Good morning, sir.
Mr. Fasasi?
Yes, you've paused the screen sharing. You can just start it again when you are ready, sir.
Okay. All right. Let me just go back. Let me just go back. Okay, I think I'm on now, right?
Yes, sir. Yes,
Okay.
sir. The
All
slide
right.
is showing now, sir.
Okay, can we start? Because we have another class for 10 o'clock. So,
Yes. Let's start, sir. At least everybody knows the time before.
okay. So, good morning, everyone. Welcome to
Good morning, sir.
this class. We're going to make it a speed of light this morning. And what we have is Hematology 2, which is HA 501, and is erythropoiesis. So I'm going to start straight. And I'm going to still give the slide to the class rep to share for us. So those that are not able to join early can always join us after. All right, so erythropoiesis is red blood cell production. That is erythrocyte. We all know this. Okay, we all know this. Yes. Sorry, I just did something now. Sorry. Please hold on for me in a moment. I just did something now that I have to go back to.
All right, sir.
Hold on for me, please. Okay, I'm back, I think. Can you see me? Can you see the slides?
Yes, sir. The slide is
Okay,
showing.
all right. So erythropoiesis is red blood cell that is erythrocyte production. The bone marrow makes most of the red blood cells. And once they are fully matured, they are released into the bloodstream. We all know that. And we are hematology scientists, so all these things are not strange. Now, where they transport oxygen throughout the body. Now, problems with erythropoiesis can result in anemia, and then a condition that involves not having enough red blood cells. Please, if you don't see my slide, just let me know. But I think we are seeing them because I can see it here that you're sharing. Now, red blood cells are important because the first thing is they transport oxygen through the lungs to tissues throughout the body. And then number two, they transport carbon dioxide from tissues throughout the body to the lungs so that one can breathe it out. Now, erythropoiesis is one type of hematopoiesis. Hematopoiesis is the body's process of making all three types of blood cells. The red blood cells, which is erythropoiesis, the white blood cells, which is leukopoiesis, and the platelets, which is thrombopoiesis. Where does erythropoiesis occur? Erythropoiesis starts before people are born. This is known as fetal erythropoiesis. By the time people are born, erythropoiesis takes place in people's bone marrow. And the bone marrow is the spongy tissue inside the bones. We did bone marrow in 400 level. Now, fetal erythropoiesis, the location of the erythropoiesis changes as the fetus develops during pregnancy. In week 3, erythropoiesis begins in the yolk sac. It begins in the yolk sac, and the yolk sac is a structure that nourishes a developing embryo. That is what a yolk sac is. In 2 months and 3 months, erythropoiesis occur in the fetus liver and spleen. Erythropoiesis occur in the fetus liver and spleen. In the 5th month, erythropoiesis occur in the fetus bone marrow. That is the fetus bone marrow. Then in children and adults, at birth, erythropoiesis happens primarily in the bone marrow. It happens primarily in the bone marrow. Then in children, erythropoiesis occurs in the bone marrow of many different types of bones in the children. In adults, erythropoiesis occurs in certain bones, which includes the pelvis, the vertebra, the ribs, and the breastbone. Now, the differences between medullary and extramedullary erythropoiesis. Don't forget that we are talking about erythropoiesis. Okay? Now, medullary refers to the bone marrow. Medullary erythropoiesis happens in the bone marrow, while extramedullary erythropoiesis happens outside the bone marrow. Extramedullary erythropoiesis is normal at some stages of fetal development. During adulthood, extramedullary erythropoiesis is often a sign of a disease or condition affecting the bone marrow. What this simply means is that it's not supposed to be developing, which we shouldn't have extramedullary except in a disease condition. We should always have medullary erythropoiesis. What are the stages of erythropoiesis? Okay, with erythropoiesis, an originator cell called hematopoietic stem cell, we refer to it as HSC, matures into a fully mature red blood cell or erythrocyte. A cell advances through many stages for this to happen. Now, each type of blood cell, the red blood cell, white blood cell, and platelet, begins as an HSC. Now, for a red blood cell to eventually form, an HSC becomes a common myeloid progenitor, which we call the CMP. So, you know the difference between HSC and the CMP. The CMP is common myeloid progenitor cell. Now, a CMP may mature into a red blood cell, platelets, or some types of white blood cells. A CMP that eventually becomes a red blood cell develops into a megakaryocyte erythroid progenitor cell, which we call MEP. So we have 3 acronyms now. We have HSC, we have CMP, and we have MEP. Okay, if it's going to happen in our objectives, will let us know so that we'll be able to remember. MEP is megakaryocyte erythroid progenitor cell. Now, once it's developed into MEP, the cell is on track to become a red blood cell. It progresses through the following stages as it develops. We know this: pro-erythroblast, erythroblast, normoblast, and reticulocyte. From reticulocytes, it becomes erythrocytes. Now, which is a fully mature red blood cell. Now, the bone marrow releases mature blood cells into the bloodstream. And once they are in the bloodstream, the red blood cells can move oxygen from the lungs to the tissue. They can move carbon dioxide from the tissues to the lungs, that is to be exhaled. How long does erythropoiesis take? It takes about a week for a red blood cell to fully mature. And what is a red blood cell's lifespan? Of course, we know it is 120 days. These are questions that can come up during our OBJ, which we will definitely review. Now, what causes erythropoiesis? The body's sensitivity to oxygen levels regulates erythropoiesis. If the tissue does not have enough oxygen, which we call hypoxia, the body will ramp up the red blood cell production. More red blood cells mean there's more oxygen flowing to the tissues and cells. A hormone called erythropoietin triggers erythropoiesis. A hormone called erythropoietin triggers erythropoiesis. What is erythropoietin? A hormone called erythropoietin, we call it EPO. That is erythropoietin, EPO. Spurs red blood cell production. Hormones are chemical messengers that coordinate essential body functions. The kidneys secrete most of the body's EPO, that is erythropoietin. The kidneys secrete most of the body's EPO. The process goes like this. The tissues lack oxygen because the red blood cells are low. Of course, our red blood cells are low. The kidneys secrete more EPO in response, and the EPO stimulates our bone marrow to make more red blood cells. Okay? The kidneys now detect an increase in hemoglobin, a key protein in red blood cells, and secrete less EPO in response. I take that again. The kidneys detect an increase in hemoglobin, a key protein in red blood cells, and secrete less EPO in response. Secretes less erythropoietin in response. Now, the body achieves a balance, homeostasis, where you have the right amount of red blood cells. The body achieves a balance, which we call homeostasis, where you have the right amount of red blood cells. Now, the kidneys constantly secrete low levels of EPO to keep red blood cell production ongoing. One can lose about 1% of the red blood cells each day. Erythropoiesis, however, replaces the red blood cells that have reached the end of their lifespan. Erythropoiesis replaces the red blood cells that have reached the end of their lifespan, meaning 120 days. The kidneys may secrete more or less EPO in response to conditions or injuries affecting the red blood cell levels. Now, what happens when there's a problem with erythropoiesis? Now, problems with erythropoiesis may cause one to have too few red blood cells, which we call anemia, or to have many red blood cells, they call erythrocytosis. You know, when you have too many red blood cells, erythrocytosis. Now, anemia. One does not have enough red blood cells to carry oxygen to the body's tissues. As a result, one may feel weak, tired, or cold. There are lots, or we have different types of anemia, which we know. Now, erythrocytosis. They have too many red blood cells. Depending on what's causing erythrocytosis, you may experience mild symptoms like headache or fatigue, or you may be at a risk of more severe complications like blood clots. That is erythrocytosis. Let me take that again. This is having too many red blood cells. And depending on the causes, one may experience mild symptoms like headache or fatigue, or one may be at a very severe risk of the complication of blood clots. All right, conditions that can impact erythropoiesis. Many conditions can impact the body's ability to make or regulate red blood cells. Okay, the first one, we have lung disease. We have something like asthma, chronic obstructive pulmonary disease, which we call COPD, cancers affecting the body or bone marrow, that's the second one. We have the leukemia, lymphoma, myeloma, myeloproliferative disorders. The first one is lung disease. We have asthma and COPD. Now, the second one is cancers. And we have the leukemia, lymphoma, myeloma, and myeloproliferative disorders. And we have other factors like nutritional deficiencies, like iron, B12, and folate. And we have high altitude, which means the body secretes more EPO in response to decreased oxygen at high altitudes. The sites of erythropoiesis. Now, the site of erythropoiesis changes throughout life. In the very early fetus, yeah, somebody's raising a hand. Is there any problem? Is there any problem? Somebody's raising a hand. Okay, let me go on.
No one is raising hand again, sir.
Okay. All right, thank you. Now, the site of erythropoiesis. The site of erythropoiesis changes throughout life. In the very early fetus, it occurs in the yolk sac. We said that before. From 2 to 5 month gestation, it occurs in the liver and spleen before it finally establishes itself in the bone marrow from about 5 months of gestation. Okay. In children, erythropoiesis can occur in the bone marrow of most bones. However, in adults, we've said this, it only occurs in the bone marrow of the vertebra, the ribs, the sternum, the sacrum, the pelvis, and the proximal femur. Proximal femur. When erythropoiesis is inadequate in the bone marrow, this can trigger extramedullary hematopoiesis. When erythropoiesis is inadequate in the bone marrow, it can trigger extramedullary hematopoiesis, which is hematopoiesis occurring outside the marrow. This is commonly seen in hemoglobinopathies such as thalassemia or myelofibrosis. Okay, the stages in erythropoiesis now. Now, the production of all blood cells begin with the hemocytoblast, a multipotent hematopoietic stem cell. Hemocytoblast, a multipotent hematopoietic stem cell. Hemocytoblasts have the greatest power of self-renewal of any adult cell. They are found in the bone marrow and can be mobilized into the circulating blood when needed. Okay, hemocytoblasts have the greatest power of cell renewal of any adult cell, and they are found in the bone marrow and can be mobilized into the circulating blood when needed. Some hemocytoblasts differentiate into common myeloid progenitor cells, which go on to produce erythrocytes, as well as mast cells, megakaryocytes, and myeloblasts. These are not strange terms for us. They're not strange terms for us in hematology. Now, the process by which common myeloid progenitor cells become fully mature red blood cells involves several stages. First, they become normoblasts, that is erythroblasts, which are normally present in the bone marrow only. Okay, and then they lose their nucleus as they mature into reticulocytes, which can be thought of as immature red blood cells. Some of these are released into the peripheral circulation. We said this at the other time when I was telling us about the stages of how it develops into a full-blown erythrocytes, okay, which is the mature red blood cell. Now, finally, the reticulocytes lose their remaining organelles as they mature into erythrocytes, which are fully mature red blood cells. The average lifespan of a red blood cell is approximately 120 days. 120 days. Okay? During this maturation process, there is a nuclear extrusion, which means mature erythrocytes have no nucleus. Nucleated red blood cells present in a sample of bone marrow can indicate the release of incompletely developed cells. Let me come again. Nucleated red blood cells present in a sample of bone marrow can indicate the release of incompletely developed cells. This can occur in pathology such as thalassemia, severe anemia, or hematological malignancy. Now, the regulation of erythropoiesis. Erythropoiesis is driven mainly by the hormone EPO, which is a glycoprotein cytokine. It is driven mainly by hormone EPO, which is a glycoprotein cytokine. EPO is secreted by the kidney. It is constantly secreted at a low level sufficient for the normal regulation of erythropoiesis. EPO is secreted by the kidney, and it is constantly secreted at a low level, sufficient for the normal regulation of erythropoiesis. However, if the erythropoiesis level becomes inadequate, the blood becomes relatively hypoxic. When there is a reduced partial pressure of oxygen, that is PO2, in the kidney, this is detected by the renal interstitial peritubular cells, IPC. Let me come again. However, if the erythrocyte level becomes inadequate, the blood becomes hypoxic. And then when there's a reduced partial pressure of oxygen in the kidney, this is detected by the renal interstitial peritubular cells. Now, in response, there is a surge in EPO production, which acts on the bone marrow to stimulate increased red blood cell production. This causes the hemoglobin levels to increase, subsequently causing the PO2 to rise, and therefore the EPO levels to fall. Let me come again, because we've said this before, okay, during the course of this class. In response, there is a surge in EPO production, now, which acts on the bone marrow to stimulate increase in red blood cell production. Now, this causes the hemoglobin levels to increase, subsequently causing PO2 to rise, and then EPO levels begins to fall. Now, laboratory investigations. Laboratory investigations. Now, we have to investigate erythrocyte abnormalities. That is, we can do full blood count, or what we call complete blood count now, which is a test that measures red blood cells, white blood cells, platelets, and their, derivatives to assess overall health and diagnose disease like anemia, infections, and blood cancers. In a healthy person, these counts are within a normal range, while in disease, abnormalities such as a high or low numbers of specific cell type can indicate a problem. For instance, a low red blood cell count can point to anemia, and a high white blood cell count often signals an infection, which we all know. All right. So, for now, that is the end of the erythropoiesis. That's the end of erythropoiesis. This is 8:52. I'm trying to run with time so that we can have a little break so that we join the class. So let me pause here and see if there's any question for erythropoiesis before we move into blood count in health and disease. Is there any question?
No
Yeah,
question
any
from
question
this
from
side.
anyone? Sorry?
I said no question from this side.
From your side. So invariably, what we are saying is that is erythropoiesis. What the curriculum is telling us is just erythropoiesis, okay? And that is what we need to know about erythropoiesis, and not accumulate any, bring ourselves up to speed with some postgraduate stuff. So if there are no questions, let me just switch to the other slide, which is the second one, which is the blood counting end. So just give me a few minutes. I'm just getting used to this thing. So give me a few minutes while I log out of this and then bring up the other slide. Thank you. Just hold on for me, please.
All right, sir.
Are we all here? Are we still here?
Yes, sir.
Okay, so let's go to the second one, which is the blood count in health and disease. And that's where we're going to stop for this morning before we move on. Let's see if we can run with speed of light and cover the other slides that are there. And that means that we have moved on, So blood count in health and disease. Now, healthy state. Now, blood count falls within a normal reference range, which can vary. Sorry. Okay. Because of factors like, just let me move this. Okay. Now, which can vary based on factors like age, sex, and altitude. Now we have white blood cells, WBCs. These are key to the immune system. A normal count helps fight infection, but a high or low number can indicate disease. Okay? Now the red blood cells, they carry oxygen, and the normal count ensures proper oxygen delivery to the body. Okay, platelets, a normal number is crucial for blood clotting to prevent excessive bleeding. And then hemoglobin, this is a protein in red blood cells which carries oxygen. A normal level is essential for oxygen transport. Now, blood count in disease. Anemia, this is characterized by a low red blood cell count or low hemoglobin levels, and it leads to fatigue and weakness due to insufficient oxygen transport. Infection. A high white blood cell count can indicate the body is fighting an infection. Blood cancers. A CBC can detect blood cancers like leukemia by revealing abnormally high or low number of white blood cells, red blood cells, or platelets. Blood clots. A high red blood cell count can thicken the blood, increasing the risk of blood clots. Inflammatory diseases. Elevated white blood cell count can also signal inflammatory conditions. Okay? Immune system disorders. Remember, we are talking about blood count in health and in disease. Immune system disorders. The abnormalities in specific types of white blood cells can point to immune system problems. Bone marrow disorders. A low count of all three cell types, pancytopenia, which we call pancytopenia, can indicate a problem with the bone marrow's ability to produce blood cells. Blood count or complete blood count is a test that measures red blood cells, white blood cells, and platelets to assess overall health and diagnose disease like anemia, infection, and cancers. In a healthy person, these counts are normal, while in disease, abnormalities such as high or low numbers of a specific cell can indicate a problem. For instance, a low red blood cell count, you have said that before, indicates anemia. A high blood cell count indicates infection. Yeah, I think that is that about blood count in health and in disease. Let's move quickly to disorders of iron metabolism, vitamin B12, and folate deficiency, which that is where we'll stop for this morning. Now, disorders of iron metabolism. Now, if you remember in further level, we had something called iron metabolism, which we did, and it was, we also had it in our exams, which is cool. So we have these disorders now of the three of them. Now, disorders of iron metabolism includes iron overload, which we call hemochromatosis. Some people call it hematochromatosis. We call it hemochromatosis or hematochromatosis, where the body absorbs too much iron and iron deficiency, and where the body doesn't have enough iron. Okay, hematochromatosis or hemochromatosis leads to excess iron being stored in organs like the liver, the heart, and the pancreas, potentially causing damage, while iron deficiency can result in anemia. Now, sorry. Okay. Now you have iron overload, hematochromatosis. What is it, Gaga? Now, a condition where the body absorbs too much iron from food. where the body absorbs too much iron from food. Now, how does it happen? The body tightly controls iron absorption and has limited ways to excrete excess iron. But in hematochromatosis, this regulation fails. Okay? It fails in hematochromatosis or hemochromatosis. Now, symptoms and effects. Excess iron accumulates in organs, particularly the liver, heart, and pancreas, leading to organ damage and potentially life-threatening conditions like liver disease, heart problems, and diabetes. Therapeutic phlebotomy, that is removing blood, iron chelation therapy, and dietary changes are used to reduce iron level. I come again. Therapeutic phlebotomy, iron chelation therapy, and dietary changes are used to reduce iron levels. Iron deficiency, what is it? It is a lack of iron in the body. How does it come about? It can result from not getting enough iron from the diet, chronic blood loss, pregnancy, or issues with iron absorption. Symptoms and effects. Low iron stores can lead to iron deficiency anemia, affecting the oxygen delivery throughout the body. Low iron stores can lead to iron deficiency anemia, which affects oxygen delivery throughout the body. The treatment involves addressing the underlying causes, such as improving dietary intake of iron-rich foods. Other considerations: non-hemochromatosis overload. Iron overload can also result from other conditions such as transfusions that provide too much of iron, leading to different patterns of iron deposition. That occurs when we have too much transfusion, especially when you have patients like HBS patients that will need to have multiple blood transfusion, and then they transfuse the morning, transfuse the afternoon, and they just continue. Then that is going to accumulate iron, okay, which will lead to, iron deposition. Now, systemic disorder. Iron metabolism disorders are systemic conditions affecting various organs and can have diverse and non-specific symptoms. Now, let's go to folate. That's about that on iron. Disorders of folate metabolism are genetic conditions that affect the body's ability to process folate, vitamin B9, leading to a range of symptoms from developmental delays to anemia. Key examples include hereditary folate malabsorption, methylene tetrahydrofolate reductase deficiency, and cerebral folate deficiency. Let me say that again. Examples include hereditary folate malabsorption, methylene tetrahydrofolate reductase deficiency, and cerebral folate deficiency. These conditions often have serious health consequences due to folate's critical role in DNA synthesis, methylation, and overall cellular function. Types of disorders. We have HFM, which is hereditary folate malabsorption, an inherited disorder. It's an inherited disorder that impairs the body's ability to absorb folate from food and transport it to the central nervous system, leading to both systemic and neurological problems. The MTHFR deficiency, methylene tetrahydrofolate reductase deficiency, a widely studied inherited disorder caused by mutations in the MTHFR gene, which results in a deficiency of the MTHFR enzyme. The severity of symptoms correlates with the degree of enzyme deficiency. Now, CFD syndrome, that is cerebral folate deficiency syndrome, a condition where folate levels in the cerebrospinal fluid are low. A condition where the folate levels in the cerebrospinal fluid are low. Even if folate levels in the blood are normal, this can lead to developmental disorders and autism spectrum disorders. I come again. A condition where folate levels in the cerebral spinal fluid are low. even if folate levels in the blood are normal. This can lead to developmental disorders and autism spectrum disorders. Now we have the you have the glutamate formaminotransferase deficiency. Glutamate formaminotransferase deficiency, a disorder caused by mutations in the FTCD gene. Okay. Now, other related disorders, we have the methionine synthase reductase deficiency, which is related to the methionine synthase reductase, and then the methionine synthase MTR deficiency, which is related to the methionine synthase itself. The first one is reductase, the other one is the synthase itself. Now, symptoms and complications. We have neurological, developmental delays, motor and gait abnormalities, cognitive disorders, seizures, and behavioral disorders. We have hematological, megaloblastic anemia, leukopenia, and thrombocytopenia. We have immunological, impaired immune function, which can lead to recurrent infections. We have gastrointestinal, we have poor feeding, failure to thrive, diarrhea, and oral mucositis. Then the others, which include depression and increased risk of cardiovascular disease. Diagnosis and treatment, general, it involves genetic testing and measurement of folate levels in the blood and cerebrospinal fluid. In treatment, you have folic acid supplements, you have folic acid, and then you manage, on the treatment plans of customized based on the specific disorder and its severity. Okay. Now let's go to B12, vitamin B12. Disorders of vitamin B12 deficiency can include anemia, neurological problems, and other issues. Common symptoms are fatigue, weakness, a sore tongue, tingling or numbness in the hand and feet. If left untreated, severe deficiency can lead to nerve damage, memory loss, depression, and difficulty with coordination and walking. General symptoms. We have the general, common symptoms. We have fatigue, weakness, lack of energy, and shortness of breath. We have neurological, numbness or tingling in the hands and feet, balance problems and memory issues. And then we have oral, a sore, red, or swollen tongue and mouth ulcers. So we have gastrointestinal, have loss of appetite and weight loss. And then you can also have severe or long-term effects. Causes of deficiency, we have pernicious anemia. This is an autoimmune condition where the body cannot produce intrinsic factor, which is necessary to absorb vitamin B12. Autoimmune condition where the body cannot produce intrinsic factor, which is necessary to absorb vitamin B12. Malabsorption is a condition that affects the stomach or small intestine, such as Crohn's disease or celiac disease, can prevent the body from absorbing vitamin B12. Conditions that affect the stomach or small intestine, such as Crohn's disease or celiac disease, can prevent the body from absorbing vitamin B12. Now, diet. A diet that lacks vitamin B12, such as vegan or vegetarian diets, can lead to deficiency if not supplemented. So we have come to the end of the class for this morning. We have done erythropoiesis. We have done a blood count in health and disease. And then we have also done disorders of iron metabolism, vitamin B12, and folate deficiency. Now, when we come to the end of the course itself, and in the 501, I will give us the assignments that we are going to have to do, and then which we'll mark as our CA, and that will be after Mr. Adeyemi's class next week. So after next week, I will come back and then we'll finish on 501 by the grace of God. And then we have assignments. And then towards the end of the semester before our exams. Close to the exam, we'll have our revision where we will, of course, drill out things that we expect us to know and do and all that. So it's not going to be a difficult thing like we had in 400 level. So let everybody in hematology, please let us be calm. There's no issue at all. Both of us, we know we are both inside it, and that's what makes it very interesting. And so we want everybody to be happy, and there will not be any complaints of whatsoever. If there's any issue, please, you either call Mr. Adeyemi or call me. We are always ready to listen to us and all that. Before I say other things, let me ask if there's any other question concerning the lectures that I've given before I go into our projects so that we know what to do. Please, any question?
Thank you very much, sir. There's something I want to ask, sir. Like in sickle cell disease,
Yes.
they need to take folic acid on daily basis. Those that are sickle cell, that have sickle cell disease, but they are not to take any drug that contains iron. So, and from what can lead to anemia, iron is one of them.
Yes.
So I used to think, how is it true only through the food that they get the iron, and the ions that they get through the food, is it not going to have any effect in their system? How do their system make up for the ions? That's what I want to answer.
Okay, I think that even through blood transfusion, that's why I said multiple blood transfusion can cause serious deposition of iron. Okay, that's why they have to go to clinics so that they can check, their iron levels. Okay, and they are not supposed to overload the system with iron. Otherwise, it will cause a big problem. So I think the clinical state of the sickle cell patients is really determined by the follow-up that they go for during their as they go onto their clinics. They have to go for follow-ups. When they go for follow-ups, investigations are done. And that is when the clinician will look at what they have, what the level that they are, and then prescribe appropriately. And that's why they should not joke with clinics, joke with follow-ups. Okay?
Okay, sir.
Because
Okay,
it shouldn't be totally absent,
thank you very much, sir.
and
Yes, sir.
it shouldn't be too much in the body. Yeah. So any other question, please?
Okay, sir. Thank you very much.
All right. So if there are no questions, so that we can go
Any
take a
other
break and
questions?
prepare. The class rep is going to give me the list of everyone in the class. And then between Mr. Adeyemi and I, we will reel out the supervisor for each student. Okay. And then so that we can start working behind the scene. So if there are things that we need to adjust between you and the supervisor, you can start adjusting, and then we will get in touch with the general coordinator, Mr. Odekomi, to adjust such at the central level. Okay, because what they have now is what we have given him. So if there are going to be changes, we need to inform. Hello? I hope you understand what I just said.
No, sir, I can't hear you, sir.
Yeah, I said, sorry, I had a call. I said that we would, once we are able to have the list of the class from the Hello, are we together?
Yes, sir. We are together, sir.
So then we will be able to assess the topics, and then if there are adjustments, we will inform the general coordinator, Mr. Dekomi. and then we'll continue to work behind the scene as we continue with the classes. All right. I hope it is clear.
Yes, sir.
All right. Thank you very much. So if there are no other things to talk about, I think we should just call it a day and wait for the class at 10 o'clock, the central class at 10 o'clock. That's at about 45 minutes time. We finish to time, 45 minutes time, and then we will go on from there. Okay, so we'll meet tomorrow by 6 p.m. by the grace of God. Just about an hour, we should be done tomorrow, 6 p.m. by the grace of God. All right, thank you very much, everyone.
Thank you so much, sir.
Thank
All
you
right,
for
appreciate you. All right, thank you so much. All right,
Yes, sir.
so have a wonderful day. We'll meet at the general class. All right.
All right, sir. Thank you very much, sir.
You're welcome. You're welcome.
Bye-bye, sir.
All right, bye. Bye, everyone.
Thank you so much.
Yeah.
Thank you.
Oh, yeah, I'm 5,000.